I am going to begin with a short video of the OnMed care station to give a little bit of context before we move forward. And then we'll go into the details of the functionality and what venues and locations we're currently in and how you can maybe visualize this in your particular workspace.
Meet the OnMed Care Station, an 8 by 10-foot answer to a 120 million person healthcare access problem. A clinic in a box. We go where others can't and won't. No appointment, no waiting room. Just walk in and press start. Within seconds, you're connected to a live clinician on a life-size screen, 65 inches. Large enough that it feels like they're right there with you. When it's time for care, the glass fogs and the door locks. A care coordinator guides you through the intake process, answering questions, collecting vitals, understanding exactly why you're here. You're now in a fully private clinical environment with a licensed medical provider. Built into the care station are advanced diagnostic tools, a digital stethoscope, blood pressure cuff, thermal scanner, otoscope, and high-definition camera. Tech-enabled, AI-powered, human-delivered. We diagnose and treat most everyday health conditions, like colds and flu, respiratory conditions, skin conditions, urinary tract infections, GI issues, earaches, and allergic reactions, plus ongoing support for chronic conditions, like diabetes, hypertension monitoring, cholesterol management, and asthma. Diagnosis, treatment plan, e-prescription. 20 minutes, done. 86% of patient needs are handled right here on site. The rest are routed seamlessly to the right level of care. After each visit, the care station activates a UVC self-cleaning cycle, killing 99.9% of germs and preparing a safe, sanitized environment for the next patient. 8 by 10 feet, easily integrated into the places where people live, work, and learn. Healthcare when and where you need it most.
Okay, so that is what we call our clinic in a box. It is an 8-foot by 10-foot clinic, as you saw there. It's fully ADA accessible. Some of the features that they didn't show there in the video that I wanted to talk about that are particularly relevant, I think, to Wyoming is, there are many broadband deserts in the state of Wyoming, and that really makes traditional telemedicine inaccessible. You really have to have some significant broadband to have those video visits. So not only is the OnMed care station broadband enabled, we're also satellite enabled. So we can go out into communities, and we are in communities that have little or no broadband connectivity. When the patients enter the care station, the most digital literacy they need is to be able to press that start button that you saw on that big 65-inch screen. All the paperwork, all the intake, it's all done on the OnMed side. So patients who have some dexterity issues or literacy issues, no worries. We do it all on the OnMed side. Once they hit that start button, a care coordinator, a live care coordinator comes on the screen within about 15 seconds. They talk to the patient, they get all the vital signs, they go through many of those diagnostic tools that you saw there on the video. There's a scale in the middle of the floor. There's that thermal camera that you saw. That's a non-invasive temperature measurement. It's also definitive for inflammation and sinus type infections. We have the blood pressure cuff you saw, the pulse oximeter that does blood oxygenation and heart rate. We also have that high definition camera and stethoscope inside the care station, as well as an otoscope. So after that initial intake process is done, and the patient, if they have an insurance card, we have an insurance card scanner there, but if they don't have insurance, no problem. We see all patients. The video is then passed over to a nurse practitioner who does the full comprehensive exam. They can do a full chest exam if needed. They can take that high-def camera and look at skin conditions. They can look in the throat, the eyes, very comprehensive exam there. They can also prescribe medication, lab work, imaging, anything really that the patient needs can be handled from within the care station. Another significant part of our model is that wherever we put the care station, whatever if it's in a senior center in a rural community, if it's in an employer, if it's in just a rural community, maybe we're in an FQHC or maybe we're part of a health system. We take the time to connect with the nonprofits in the area around the care station, along with the community leaders and stakeholders. And the reason we do that is because we have a playbook for each care station that our clinicians can see as they take care of the patient, so that if they uncover additional needs beyond that acute condition that the patient is coming in for, we can refer them and give them that warm handoff to that next level of care, whether it's, to a housing authority. If they have some issues, maybe they need to get signed up for Medicaid and they don't know that they qualify for Medicaid. Whatever the issue, maybe it's a referral to a specialist. We are able to give that patient a warm handoff to the next level of care. Our electronic health record on the back end, it allows us to send care summaries to, if the patient has a primary care provider, we can send those care summaries on to that primary care provider. We can also receive information into our electronic health record from other care sources in that community. So it's a very comprehensive care. We want to be part of a hybrid care model in these communities. We don't just want to treat and release patients. We definitely want to be integrated into that community and that health system that's local to that community. I'm going to move on here. We take care of patients ages 2 years of age and older. And our clinicians also are English and Spanish speaking, but we also have a language line embedded into our care station that can translate up to 240 languages in real time. So it's a very interactive, very accommodating care station for any type of language issue. Now, why do we have care stations out there in the first place? Well, as you can see here on this slide, we still have 120 million Americans that don't have broadband access, that really make access to care via telehealth impossible. We have 11,000 souls aging into Medicare each and every day in America, 11,000. A third of them have more than one chronic condition. And we have 75% of Americans that are now deemed overweight. So you can see we're getting older, we're getting sicker, and we're getting heavier as a country. And you put that alongside our two existing modalities of care, which are brick and mortar and our traditional telehealth. And those are absolutely maxed out. We really have a broken system right now where it's just financially it's difficult to continue to build brick and mortar in the communities. It's very expensive. And then you still have to find providers to staff those clinics, which, as you can see here on the slide, we're already 200,000 providers short, based on, if we had enough to take care of all of our Americans, we would have, we're still short 200,000, and we're only graduating about 29,000 physicians a year. So we have this ongoing shortage. And of the ones we have practicing, about 50% are pre-retirement. So you can see we're going to be playing catch up for quite a while on the provider side. And as I mentioned with the traditional telehealth, you still have to have broadband. And most traditional telehealth, where you're on your phone, you're sitting on your couch, maybe, you don't have access to all these devices that are really needed for a comprehensive exam. So that's why today, even in the post-COVID pandemic era, still only about 8% of visits on the outpatient side are telehealth due to those limitations. Let me get my cursor back over here. So OnMed is definitely here to build out this missing layer of healthcare infrastructure, not only in rural, but in truly medically underserved communities, which can be urban or rural. So we're looking at the care stations, each one of them as a node, if you will, in this layer, this network layer that we're trying to build of connectivity from the existing clinical and healthcare systems into this hybrid care model. The conditions that we typically treat are here. Our typical patient will come in with flu, sinus type infection, and as they're in there, they're diagnosed with hypertension, serious hypertension. Sometimes we've had to call EMS several times to our care stations for critical issues, either with breathing, with cardiac events, with seizures we've had, and of course, dangerously high hypertension. So we actually have saved quite a few lives right there in the care station, as it were. Some of our top prescriptions are there for some of the most common conditions: asthma, allergies. We do antibiotic prescribing, and of course, high blood pressure, diabetes, that type of thing. We screen each and every patient after their visit. We say, where would you have gone had you not had an OnMed care station? And 65% will tell you we would have gone to the ER or urgent care had it not been for OnMed. So we can treat, as I mentioned, about 90% of what walks into our care stations without a referral, which is really significant to keep those lower acuity patients out of the ER. Whether that, if you're an employer, this helps, with your employees that, have to take half a day off of work just to go to the urgent care or to sit in the ER, because we know many of these folks don't have primary care providers, or if they do, the wait time to get in to see a primary care provider is weeks, if not months in some cases. Um, we have these care stations, we're on university campuses and soon K through 12 campuses. University students love the care stations. They love the hours of operation. We are 7 days a week from 8 in the morning till 6 p.m. in the evening. So very extended hours of operation. Um, and the students use it, the employees use it, the staff uses it. We have one that's sitting on the edge of a university campus. The community comes in to use it as well. So it's a very highly utilized care station location. If you're a health insurance payer, we have many payers that are sponsors of our care stations. They tend to put these in high Medicaid markets. And the ED avoidance is a very big piece of the ROI for our payers, as well as the ability to monitor and diagnose and maintain chronic conditions outside of the hospital. Our government sponsors who might be in public health clinics, we absolutely close those provider gaps in many of these rural clinic areas. And we have wraparound services available in these areas depending on where we put the care station. We try to intentionally put them in areas. Maybe it's a community pharmacy we're putting these in. So we have these wraparound services close by. So we try to make it very easy for patients to get the care that they need. We have many partnerships with health systems. And the beauty of that is it doesn't have to be our clinicians behind the camera. It can be that health system's clinicians behind the camera. Or, if they don't have the clinicians to provide, to give the visits, we can credential our clinicians as part of that health system. So we, in fact, expand the network reach of those existing health systems. As we see patients, we will be referring them back into those health system networks. So we avoid that leakage out of the network, which is really significant. You'll see here on the statistics side, I've covered many of these in what I've already covered now, but it's a significant savings, between the ED diversion, the referrals, and now, I'll talk about claims, because our model, our payment model, and I'm going to advance to that here real quickly. We are a subscription-based model. So that means, for a flat fee every month, we will see patients, as I said, 7 days a week from 8 in the morning until 6 in the evening. On the back end, we send those encounter files. If the patient has insurance, we will send those encounter files to our sponsor, whether it be a health system, a hospital, an FQHC, maybe it's a health plan. We'll send those encounters to the sponsors so that they can file the claims and get that reimbursement. OnMed takes no money at all for those claims for that reimbursement. It's just the flat subscription fee. And that covers the licensing, the hiring, the credentialing, the maintenance of the care station, the installation, all of it, soup to nuts. It is plug and play. It just takes a three-prong plug to plug in the care station and a dedicated internet line that is powered, as I said, either by broadband or satellite connectivity. That's as much as we need to start seeing patients. So it's a very, very easy model. All of our patients that come into the care station, they are not charged a fee to be seen. So it is a free healthcare source for them so that they keep coming back time and again for their healthcare. And again, on the back end, that's where we send the claims for the reimbursement for our sponsors, coupled with, like I said, the ED diversion and also the referrals into the network. I wanted to back up just a little bit. I skipped some slides here a moment ago, but I also wanted to mention this summer we are adding mental health consultations as part of our suite of services, which is super exciting. That is definitely a high need service in our communities. Substance use disorders will be managed, as well as opioid addiction, anxiety, depression, and of course, we're talking, there's a significant incidence of suicide, especially in rural communities. And a lot of that has to do with access, and some of it has to do with the stigma of mental health treatment. The beauty of the OnMed care station there is that, once the patient walks in and the door closes and the windows fog, you don't know if that patient is going in for a sinus infection treatment or if they're going in for a mental health counseling. So it really destigmatizes those mental health consultations. And so we're very excited and encouraged to be bringing mental health consultations for both adolescent and adults starting this summer as part of our service offering. As you can see here, we are able to put a sponsor's logo on the outside for marketing purposes. So if you're a health system, if you're an employer, if you're any sponsor that is paying that subscription fee can put whatever logo they would like on the outside of the care station to show that this is their contribution and their care station. So I'm towards the end of here of my slide deck, which I'm happy to share this recording and this deck with the group after this. But I want to give some time here for some questions and answers specific to your area. If you have any questions that I can answer for you immediately on this, but we're happy to schedule other meetings separate and apart from this if you have more specific questions. Erin, yes, welcome.
Hi, thank you. I'm sorry, and you might have said this already. So if a senior came to us and was looking for something immediate, can they just go ahead and find a local location and do that? Or that you have to schedule an appointment?
It's all walk-in. And we have the ability to schedule appointments. However, none of our current sponsors have opted for that. They like the opportunity for patients to just be able to walk in at their convenience and use the care station. So yeah, they can just walk right on in. And in fact, they can check vitals in between appointments too. They can go in and check blood pressure or their weight or their heart rate in between visits. They don't even have to press the start button. They can just go in and check that. And the fact that the care station entirely self-cleans, it goes through a 90-second sanitation cycle in between each patient, takes very little in the way of workforce to maintain the care station.
So you would wait for someone to come. If you saw someone coming out of the care station, you would wait for that 90 seconds or so for it to clean,
yeah,
and then you'd be able to walk in and push the start button.
Exactly. The door will close and the windows will fog and it'll say currently in use. It'll lock the door so that the next person can't come in until the care station is cleaned.
Okay, thank you.
Do we have any other burning questions out there? I know I gave a lot of information there in a short amount of time, but I definitely can see how this could be very effective in Wyoming in a variety of settings to bring healthcare closer to home. It looks like there's a chat question. Let me see if I can toggle over there. Um, where are some of the communities? Do I provide services and any in the Cheyenne or any plans? Great questions. We're currently in 7 states and Puerto Rico. We are in places like university campuses, senior centers, homeless shelters, public health clinics, FQHCs. We're about to go into the emergency room of a very busy emergency room. We are, gosh, in correctional facilities. We are in grocery stores. Just about anywhere, people live and work. We're in large employers. It just really depends on the need. But primarily rural applications are dominating our placements at this point, simply because that's where they need the access to care, and that's where the largest provider shortages are. As far as Wyoming, we can definitely utilize and leverage some of the RHTP funds that have been approved for Wyoming for implements like OnMed. It's very the RHTP funding is very heavy leaning into the innovation side and the tech side. So these care stations would definitely qualify for some of that funding if and when it comes time for RFPs. We're always looking for partners to help bring this to communities across the state. So
Dale has a question. I don't know if you can see his.
Hi, Dale.
Hello, how are you?
Excellent.
So my question is, since we had our conversation, it's more about the businesses you mentioned. So, I talked to you a little bit about Sentinel missile system and what we're doing, but so there was some interest in a couple of the companies surrounding that. How would they go about getting one of these facilities in they're going to have like a work camp. So
Sure.
looking at putting it in there, I talked to some oil field guys and they said, hey, we'd like to have something like this on one of our sites. How would they go about doing that?
They would just email me, and I have, some information. They can go to our website. There's a place they can, request. We'll set up a call with them. We'll see, what their needs are, and we can get one on site. Basically within 30 to 45 days of signing the contract, we'll be up and ready to see patients.
Okay.
We also, from the employer standpoint too, a lot of employers offer a lot of really wonderful wellness programs that the employees just tend to not take advantage of, either because they don't know about them or they really just can't keep up with it. This is another great integration for OnMed because we're aware of those wellness programs that sponsor or that employer would have, and we can help guide patients into those programs as we triage them, diagnose them with different conditions, and that they could benefit from their employer standpoint, or the community. Maybe they have a special program set up for chronic conditions or advanced help in the community. We certainly would know about those and can help to connect those patients to those programs.
So the other question that from that business perspective again is, if my employees have insurance, but I'm in a rural area, how does OnMed and this whole process interact with insurance?
So we would scan their insurance cards in the care station, and then we would send those encounters to the business owner so that they could then file the claims on behalf of those employees, or it goes to their health plan, whoever is set up to receive those claims, and they file the claims, and the reimbursement then goes to the company and to, however they have it set up. OnMed does not collect any co-pays. We don't verify eligibility. We don't do anything. We pass those encounters to the employer, to the business, so they can handle those claims just as they would as though that patient was seen in a primary care clinic.
So if you had multiple businesses using the same
Right.
OnMed center,
We can
you wouldn't,
bifurcate that data by the sponsor. So if this patient comes in and they're with, company X and the other one's company Y, and they scan their cards, we will only send that patient's data to their company. We can, on the back end, we can separate that data so that none of that PHI gets sent to the wrong entity. We have several care stations that are co-sponsored, if you will, by two different entities.
okay.
I'll pitch one out there. This is kind of like the nuts and bolts what happens. So what happens if somebody goes in to the care station and they have a seizure, they throw up, they need something more? How is that handled in the care station?
Great question. So on the implementation side, when we're putting the care stations in, we take the time to notify the local EMS so that they know where the care station is. They know all about the function that we're doing on site. So if there is an emergency, our clinicians will call EMS while they're staying on the call on the screen with the patient. When EMS gets there, the clinician then speaks to the EMS professionals and gives them a handoff as to what happened, in the care station so that they can then effectively transport the patient to the hospital. Now, if there's biohazards, as they call them, in the care station, we have the ability to lock the care station. And we deploy the cleaning team. And the care station has to be cleaned on the outside, wiped down on the outside, and the floor cleaned once a day. The sanitation works for all the devices and everything, but as far as physical matter like biologics and that type of thing, we always have a cleaning crew as part of our implementation that is hired to come in. And if there's an urgent accident like that, we lock it down until that cleaning crew can get there to clean out the care station. As far as maintenance issues, and we are online all the time with our equipment. It's a live feed, so we know something goes wrong in there with the equipment before anybody else does. We can fix most of every problem remotely with our technicians, but if not, we will deploy a team out to the care station within 24 hours to fix any issue. So the sponsor is not responsible for anything more than the monthly subscription fee.
I think you've covered most of the other questions I had written down.
Well, I am delighted to have been here. Again, I have this presentation recorded. I will send the recording link out through Amber so that any member that wasn't able to attend or wants to rewatch this can certainly have the link. And I'll also send out a copy of the presentation so that you'll have all the contact information. And if there is specific questions and people want to have a meeting separately about their specific application, I am happy to do separate calls with anyone that would like.
I did put your email address in the chat if everybody
Thank you.
sees that.
I appreciate that.
We're gonna send this out. There are several people that couldn't make it today. It looked like we picked about the worst day to do it for them, but they'll all watch it if we get it to them. So just as long as Amber gets that and can get it out across the state, we'll start getting it out to make sure everybody looks at it.
Yeah, absolutely. I so appreciate that. And the ones you've already connected with, you can just connect them to my email and I'm happy to talk to them about their needs.
Thank you.
Thank you all. Thank you, Carrie, for arranging.